So there's another ligament issue which we'll get to look at, and this is what is known as what? Ossification of the posterior longitudinal ligament. Ossification of the posterior longitudinal ligament. So for this one, it's just a spinal condition. This is where the posterior longitudinal ligament, now this is a ligament that runs along this place. Okay, so the ligament is actually what gradually turns into bone. So it can lead to what? Spinal cord compression, especially in the cervical spine, alright, and may cause a lot of neurological issues. So causes and risk factors, the exact cause is not really known, but it likely involve what? A combination of your genetics, your hormonal component, and also environmental things, trying to actually decide this. So it's common in men, especially men in the what? East Asia. So it's associated with conditions like idiopathic skeletal hyperostosis and ankylosing spondylitis. Okay, so risk factors may include diabetes, obesity, and you are taking a lot of food that have a lot of what? Diet. Okay, so you can see how the x-rays should look like. Okay, posterior, there's ossification of the posterior longitudinal ligament. Is becoming a bone, all right, instead of remaining as a ligament. So symptoms is neck pain, numbness or tingling in the arms or hands, difficulties walking, there's loss of bladder or bowel control, radiculopathies or myelopathies, right, due to the spinal cord and nerve root compression. So diagnosis, you use x-rays, x-rays will show you the abnormal ossification. CT scans are best for visualizing these ones though. MRI also helps to access if there's any spinal cord involvement. Okay, treatment options is surgical interventions for progressive cases, anterior decompression and fusion, posterior laminectomy or laminoplasty. Okay, the combined approach depending on the spinal alignment and also the severity of this condition. Right, so that's just what the ossification of the posterior longitudinal ligament simply entails.